Bismillahirrahmanirrahim. Assalamu alaikum everyone. This is Dr. Mubasshra and today we will discuss about dengue fever. What is dengue fever? What is the etiology? How we diagnose it and how we treat it. In this video, I will share about the introduction of dengue fever, types of dengue virus, transmission, pathogenesis, clinical features, phases of infection and management plan. So let's start with the introduction. Dengue fever is an infection caused by dengue virus, which belongs to the family Flaviviridae, which includes subsets of dengue virus. There are four types of dengue virus, Dengue 1 to Dengue 4. These are enveloped viruses and are single-stranded RNA virus. It is present in tropical and subtropical climates, especially in Southeast Asia. Now let's talk about the transmission of dengue virus. It is transmitted by mosquito bite and the mosquitoes are Aedes aegypti and Aedes albopictus. It is the same mosquito which causes yellow fever. Now let's discuss about the pathogenesis of dengue fever. Dengue virus is attached to the host cell and it enters the host cell. After entry, it disassembles into its viral RNA. Then there is replication of the virus inside the cell. Then the virus assembles itself. After this, there is maturation of the virus and then it releases from the host cell. Then this dengue virus infects the local lymph nodes and enters the blood as well. So talking about the algorithm of pathogenesis of dengue fever, it includes fusion, disassembly, replication of the virus, assembly, maturation and release of the virus. Now let's talk about the clinical features of dengue fever. It has variable clinical presentation. The symptoms vary from asymptomatic to life-threatening, and they can include fever, headache, retroorbital pain, myalgias, and arthralgias. The incubation period ranges from 3 to 14 days. There are three phases of infection: febrile phase, critical phase, and recovery phase. And it is not necessary that every patient lands up into critical phase. So, talking about the febrile phase, the symptoms last for 3 to 7 days. It has fever of sudden onset, high grade, more than 38.5 degrees Celsius, headache, retroorbital pain, myalgias, and arthralgias, as well as nausea, vomiting, abdominal pain, and diarrhea. Patient can have lymphadenopathy, that is swollen tender lymph nodes, and even hepatomegaly, especially if it is a case of severe presentation of dengue fever. Patient can have maculopapular rash, and especially the severe presentation of dengue fever is seen in those patients who have first dengue infection. Patients also can have respiratory symptoms, for example, sore throat, cough, and nasal congestion. And also, they have bicytopenia, that is leukopenia, decreased white cell count, and thrombocytopenia, that is decreased platelet count. Patient can also have transaminitis, that is elevated liver function test. Now, talking about the critical phase, it occurs only in small subset of patients, and it is most likely to occur in patients who have secondary infection, especially within 18 months of a primary infection. It is also common in patients with other medical comorbidities. The critical phase lasts for 24 to 48 hours, and even in this phase, thrombocytopenia can be very severe, less than 20. There is increased risk of bleeding, for example, melena, hematomesis, epistaxis, hematochezia, menorrhagia, and these symptoms are then called as deadly hemorrhagic fever. In critical phase, there is also vascular leakage. It can lead to shock and multi-organ failure, for example, acute kidney injury, liver failure, and CNS involvement. Then this is called as dengue shock syndrome. Now, talking about the recovery phase, it includes resolution of vascular permeability and risk of hemorrhage. The vital sign stabilizes. There can be eruption of a new rash which is similar to the first rash, and this rash can be pruritic. Patient may have fatigue which can last for weeks to months. Now again the same thing, that is mosquito bite. After that there is incubation period. After that there is onset of symptoms, febrile phase which can last for 0 to 7 days. Then the critical phase of 1 to 2 days and the recovery phase of 3 to 5 days. Critical phase has potential clinical issues, for example shock, bleeding and organ impairment. Now let's discuss about the diagnosis of dengue fever. Basically, the diagnosis is made by dengue NS1 antigen, which is performed in 1 to 3 days of illness. And after that, dengue serology is performed, anti-dengue IgM. By day 4 of infection, it can come out to be positive. Treatment is usually supportive. Acetaminophen for symptom relief, and patients are asked to avoid using NSAIDs due to anticoagulation. And rest, there is symptomatic treatment and IV fluids. Prevention of dengue virus is mosquito nets, mosquito repellents, and dengue vaccination. But the dengue vaccination may not have full protection against dengue infection. It can only reduce the symptoms and length of infection. Thank you so much. Stay blessed. Allah Hafiz.